Yes, pleasure on behalf of the Academy of Orthopedic Manual Physical Therapists. As we do innovative methods of teaching, newer courses, we develop newer techniques to match the necessity of the patient's clinical presentations and advancing the profession of physical therapy and through establishing excellence all around the world. We have people who have inspired AOMPT right from beginning, both individually to me and also a large number of professionals have got inspired by them. Of course, like in the expert panel, we have Dr. Siddiq and we have Dr. Bhaskar Reddy. In that line, Dr. Syed Mohammad Waris is the name itself reflects that willingness to share his experience and expertise selflessly. Okay. And sir is known for his neuro rehab and balance approaches, the vibration therapy, evolving it to every level. Okay. So on behalf of AOMPT, I would request our General Secretary, Darshana, to welcome sir. And then sir will take over and address the participants on the cranial neuro manual therapy course, the cranial nerves, neural mobilization and things. Sir's perspective. So over to Dr. Darshana, then to sir. Yes, ma'am.
Yes, sir. Thank you, sir. Good evening, sir. Good evening, Dr. Waris. And a very, very warm welcome to you today for this
Thanks a lot. It's my pleasure to be here, and it's great to be associated with the AOMPT and the team itself. And I really appreciate how zealously you people are working in uplifting, although not recognized by many of the fraternities, but you are doing your best to bring up the new upcoming torch bearers who are going to light up the roadways for the physiotherapy in India and around the globe. So it's really great you people are doing.
Thank you so much, sir. It's a pleasure that you are you spare time and you are here with us today.
No, I have to, because when Dr. Senthil says anything, I cannot say no.
Thank you so much. We are anxiously waiting to hear from you, sir.
Yeah, first of all, I'm highly thankful to the entire team of AOMPT, especially Dr. Senthil and Dr. Darshana and Dr. Ritu and Dr. Neeraj. Even though I don't know whether he is here or not, I'm thankful to everybody. And for inviting me as a guest of honor over here. And still I'm a student, but I don't know. I sometimes really feel ashamed to call myself as a guest of honor. So
the honor is for your passion. Okay, your passion.
Yeah, thank you very much.
Honoring that.
Yeah, thank you very much for calling me for the closing ceremony of the Certified Cranial Neuromanual Therapy Specialist course over here today. And I have been following Dr. Senthil since from the beginning, how he is doing the things. And it's really incredible. And really, it's not because he's here and I'm speaking about him, but it's really true that the way he is teaching is entirely incredible. And I personally like it very much. And I feel like as if he can cover up, I think, 3-4 semesters in one semester. And that's how his way epigrammatical style, and I really appreciate kudos to it. And regarding the art of teaching and in-depth knowledge of Dr. Senthil, it's always there. And I was very fortunate to be with him when he centuried in the conferences. I think so. It was in UP when he 100th lecture, and I was looking where I have to go now. It was too high for me for 100 lectures and all, like but alhamdulillah, he is doing very wonderful things, and especially in which is very important, mixing up the things all together. Like, as you know, I don't know how many of you will agree with me that mostly when we talk about neuroscience, we are only confined to Bobath, and we're confined to, some people are confined to the Bobath and they are conducting the I'm not against it, please, I'm not against anything, but still teaching in a workshop from morning till evening, only the turning, it's really going to be in this century, it's not going to work out. So what is there that combining the new techniques all together, this is what we want. Taking something good from Bobath, from Roots, from Keats, and something innovative, which I liked in Dr. Santhal. He is trying to innovate the things, combine the innovation, and go ahead. This is the idea behind it. And regarding the idea, I have been following, as I told you, that Dr. Santhal's lectures about this neuro manual therapy course, which are excellent. And the main, I think the main motive behind this for the students and for the physio fraternity who was joining this is to upgrade, polish the skills, and mostly research orientation. Doing the case study, after case study, publishing it, and this research paper will become a guideline for the particular case for the other physios to follow up, which is very much lacking. And it's really great that they are doing these things, research orientation, which Dr. Siddiq, I think, has put on the things also all together along with Dr. Senthil regarding the research orientation programs which are going to be conducted. And by combining this neuro mobilization and neurodynamics along with the other neurotherapeutic techniques, really Dr. Senthil along with the team of AOMPT has really done the wonderful job, and it is a proud moment for us that the combined way is coming and emerging from India. I haven't heard myself. I'm only, if I go to some schools of thought, they only teach you particularly, only some school teach you neurodynamics, that's all. Some teach you neuromobilization techniques. And this is the first time what I am saying, that all together neuromobilization, neurodynamics, and overall topping it with the cranial nerves and rehabilitating it, and how Dr. Santhal explained these cranial nerves, and it was really wonderful. I was following everything, each and everything, and I'm hoping that Dr. Santhal is going to take up the visceral also, along with the vagus nerve and the visceral mobilization. That will be very wonderful. And the students should take an advantage of learning, even though due to the pandemic, it's all been now confined to the virtual world. But as of now, because everybody is going for the vaccination and things are adhering to the these SOPs and all, we can invite Dr. Santhal. I think I have already planned up with Dr. Santhal that he should come to the Wahab Center in Kashmir, because it's his own. So he can come over there and teach over there in person, which shows really a difference. While talking even though how much you can understand in the virtual world is something else, when it comes to a touch, to feeling for physio is very important. Although we can acquire knowledge at any know-how, but when you come to a touch, that means something, like personally being and off the screen is more important. Hands-on, what I mean to say, hands-on techniques. And I already requested Dr. Santhal to, along with the team, to come to Kashmir and start up teaching the many people over there, those who are very much interested in neurodynamics and all. And while talking about the cranial nerves and all, Dr. Santhal has spoken about the cerebral palsy and the oral rehabilitation. We are coming up with Z program, also Z vibes, because I'm working on vibration therapy mostly. And one of my paper has been published with respect to the matrix in case of matrix rhythm therapy in case of quadriplegic patients, which has already been published. Now I'm working on which I want the thorough guidance of Dr. Santhal in this regard. We are going to have a workout on Z vibes, which are upcoming rehabilitation program, which AOMPT, I think we are going to have a webinar on it, Z-Vibes, very soon. And we'll be talking about something modernization, like giving it a modernization touch to the neuromobilization and cranial nerve rehabilitation techniques and all. And I can say that each nerve which was explained by Dr. Santhil was beautifully explained. And I think those students who have attended this program should ask Dr. Santhil for an hands-on program. Because what I feel, it's my personal point of view, that I'm talking about on a personal perspective, that if Dr. Santhil is going to take hands-on, it is something different, because he will make you to feel the nerve. Okay. And when you are, because you cannot treat a patient on screen, even though we can say telepathic medicine is there, no problem, that is there. But when it comes, when the patient is coming to a clinic, or you are visiting a patient, or you are going to a hospital to visit a patient, you need to feel the nerve, you need to feel the patient. Patient needs a touch. We cannot treat him verbally or virtually. Virtual world can bring many things, but not the touch, which is very important. And what my another perspective is that we should take an advantage, I will say, of Dr. Santhil, because he is having many publications, many publications in international journals, national journals. Those who are upcoming physios and all, they should approach Dr. Santhil for how to go about these things and all, so that this knowledge will spread and it will not be confined to one station. Our main motto should be, what you have learned, pass it on. Okay. Don't pass it on like nowadays I can see some of the things like a student gets passed out and he starts its own workshop. For doing a workshop, you should be thoroughly living that subject, not studying, living that subject. Living that subject will make you to understand the subject fully, and then you can teach others. It is very hard to become a teacher. Dr. Santhil will better explain this thing, that becoming a teacher is very, very difficult.
Only the best students can become a teacher. Okay?
Yes, exactly. That's why I told
lifelong we want to learn. Okay, so that spirit, whoever has, only can become the teacher.
Yeah, absolutely. So now what I was saying, that ZY program we are going to bring up very soon on AOMPT, and also we will talk about vibration therapy and all, and we will be combining now. I'm planning that we will sit, Dr. Santhil, me, and some other expertise will sit down, and we will come up with a new innovation in neurorehabilitation science, which will be very soon. And I wish all the very best for all those who have attended the program of this the subject, the cranial nerve mobilization and neuro-manual therapy for the cranial nerves. And I wish them all the very best. And I request them, it's a personal request, because it is not like a request, is because I want you to prosper, not to just listen the lecture and go home and sit down. But I request them, implement it in your life, in your practice. Implement whatever you have learned, implement in the patients. Have a patient, evaluate him, take a deeper assessment, implement the program which Dr. Santhil has taught, take an assessment and go for follow-ups, so that you'll make a paper, then bring it to sir, he will look it and he will publish it. This can be a program for other future coming physios as a guideline, if Dr. Santhil will agree on me, on my viewpoint.
Case-based evidence.
Yes, yes. So evidence-based research, how it comes up when you are doing thorough research, A patient comes, see more patients, get the data, and go ahead. And I wish all the very best to team AOMPT for further on giving the best out of. I think how you people are silently doing these things. It's more than a bang, more than a bang. Silently, when a person speaks, listen what I'm saying. Silently, a person speaks is a bigger bang. Okay. All the very best. And thanks for, once again, thanks for inviting me.
You can see the effect of the poet. Okay, the poet inside Dr. Waris. Okay.
Thank you.
I have put that cover, the earning heart. Okay, it's a compilation of expressions. Okay. Very poetic, very enlightening the soul. Okay, you might get your own meaning when you are reading that. Every person, depending upon their personality, will get the meaning. Okay, from that same book.
Thank you very much, Mr.
Something which he can go deeper, go beyond individual differences. Okay, and those lines are really very. You should definitely experience that. Okay, so
thank you
it's
very
worth
much.
it.
Thank you very much.
The great effort. Okay, what sir has done, I don't think he could do without some inspirations. Okay, it should be multiple inspirations should be there. He's
Exactly.
not revealing that.
Without inspiration, we cannot do anything.
Okay, so something is there, and it's always good. Okay, that we are blessed with such people around us. It's nice to hear from sir on his inputs, neuro rehab, and the advances, because what I actually demonstrated in the course was the tuning fork, the vibration, how we can use the mechanical stimulus to the cranial nerves. But sir was highlighting the importance of vibration for the muscles, okay, as a facilitatory technique, okay, especially the oropharyngeal, the laryngeal, okay, so that areas where, especially larynx also, okay, so where vibration is a very important life, okay, for these muscles of the epiglottis. So it's really a great things. Okay, we move on, and sir is connecting to us from Oman. Okay, so present time there is 4:30 p.m. Okay, 4:50.
It's 4:50 exactly. 4:50.
Yeah. Okay, so it's really great, and I didn't know when sir went back to Oman. Okay,
no,
I was thinking he's still in Kashmir. Yeah.
No, actually, our center is working over there, and we have built that center especially for the research orientation. And we are trying to. I have because as you know that I am working as an associate academic director for London Academy, so I have a mission over here for some time, and after that I will be entirely posted in Kashmir, and in Wahab Center we will be operating from there. And we have a lot of projects over there, and Dr. Senthil is aware about that, and he will be part and parcel of the mission. And as I told you that we have already requested Dr. Senthil to come and have a hands-on session in the Wahab Center, so that it will be better to have a hands-on session to get some more people on lineup in neurodynamics.
Okay. So it's always great, because even Oman also is very, what to say, among the nearby countries, okay, which has a very good parallel relationship with India is Oman.
Yes, exactly,
okay?
exactly.
So we have good bilateral this tie-ups. So definitely, Waris won't be feeling like I'm out of India. Okay, so he's like, he's a man of the location. Okay, the place where he is, he belongs to that place. Okay, when he comes to Udaipur, when we travel, or we travel in Lucknow, you know, everywhere I feel that he's the man of that place. Huh? Yes, Dr. Waris?
Yeah, you are absolutely right. Having an experience altogether when we used to be in Udaipur and all, it was really indeed wonderful. And hearing you during the conferences is also wonderful.
Yeah, the picture which I put was the OMPT con, the first OMPT con.
Exactly.
AOMPT
I can never forget in Jamia. In Jamia.
Yeah, yeah. So that was again another adventure thing. Okay, so sir came, reached, and he gave the lecture. And he was there throughout the day. Okay, and he was there, and he could again go back. He has to be on duty the next day there. So everything.
So
He
it was
traveled
very
all the
good.
way for the conference. He came there and then he went back. Okay. So he came to Delhi and went. So it's really great to have people around like this. So who are always like putting hand on our shoulder, like our brother, and get us going. Even the most important thing is during the tough times. Okay, everyone have their tough phases of life. During that time, he was very strongly there to tell that I know what it is. Okay, the truth is. Okay, so he didn't tell anything extra. Okay, but that meaning it came in terms of how the person supports. Okay, it's always nice to have people like Dr. Waris, and it's always good that participants listen to him, see him, know people like him. Okay, so this video which will be there in the AOM's YouTube channel. So let the future generation get inspired, okay, by seeing people who are blessed by the divine power to do betterment for everyone around. Okay. So wishing Dr. Waris also the best of luck and appreciate his contribution and presence as the guest of honor for the closing
Thank you.
ceremony.
It's my pleasure. My pleasure to be here. Thank you very much.
I request Dr. Ritu ma'am, our senior core committee member, to provide the vote of thanks and give her. She is another person. If Dr. Waris is blessed by the mighty Allah, Dr. Ritu ma'am is totally loved by our Krishna, okay, the beloved Lord Krishna, so of Mathura, okay. So she is another person who is always there with the AOMPT, okay, throughout this lockdown, and I can confidently tell, okay, a person who will always be there till the finishing line, okay. So that is Dr. Ritu ma'am. So over to ma'am. Yes.
Yes, sir. Thank you, sir. Thank you, Dr. Syed Waris, sir. Your words are really a very inspirational words. You were talking about, sir, that we feel that we are blessed, that our academy is just like a crown and sir is just like a precious diamond. So we are just getting a shine of diamond in the mean of the knowledge through the sir in every session from last 1.5 years we are getting from the sir. So sir is giving that, as you were saying that we should not strict for the neurodynamics in the bow bath or any another technique. So I want to say that for the sir that sir last 3 months back we have covered the stroke rehabilitation where sir has changed the view of neurodynamics, how we can after the bow bath and the PNF, how we can use the neurodynamic positioning itself give the best result to the stroke patient. So it's a wonderful knowledge we are getting from sir. So really we are blessed and it's our pleasure that we are listening from you, the kind words for
Thank
sir
you very
also and your inspiration word. Although 3 or 4 lectures I have attended, yours lecture I have also attended on the vibration, also one of your session, and 3 or 4 session I have recalled that I have asked many questions from you that
Yeah, I know.
yeah, so you have given a very that time I was thinking that you are so much polite person, so today I got this opportunity to see you live, so
My
it's a very,
pleasure, my pleasure.
yeah, thank you so much sir for your wonderful words, for the AOMPT, for all the team of AOMPT and for the sir, and you are such a great person. We will in future we will definitely learn more from your side also. Thank
My
you so much
pleasure.
sir.
Anytime for AOMPT, especially for Dr. Santhal, anytime.
Yeah, thank you so much sir.
Okay. So see you, sir. So without taking extra time from your schedule.
Thank you very much.
So
I
get back
just
to your
came
work
out
and-
from my session and I came here. Thank you very
Okay.
much and God bless you all.
Thank you,
Bye-bye.
sir.
Stay blessed, sir. Stay rocking. Bye.